My name is Asia, and I'm going to be talking about the Aspd condition, or antisocial personality disorder. Welcome to this. We'll dive into a topic about antisocial personality disorder. It's a mental health condition and affects individuals and how they relate to other people in the sense of right and wrong and behaviors in society. It's a very complex, misunderstood disorder that has significant implications for both individuals and the world around them. In this video, we'll explore what ASD is and how what it causes, and how it's diagnosed, and available treatments, etc. So, disorder, and this individual with ASD may or harm others and guilt or remorse. But it's important to find disorder is really about the not being able to talk to people, but someone who prefers solitude or avoid social situations. People with ASD engage in deliberate behaviors that are harmful to others and often do so with little or no empathy. Some characteristics of manipulation. It could be some manipulation, chronic disregard for others' rights, deceptive behavior, impulsivity, irritable and aggression, lack of remorse, failure to conform to social norms. Yeah, basics. So, what does this sound? This said chronic disregard for others or rights. Major symptom of ASPD is the consistent pattern of breaking the law, disregarding the rights of others, whether it's stealing, lying, or engaging in violent acts. This pattern tends to be persistent over time. Deceptive behavior, such as lying, using aliases, and manipulating others for personal gain or pleasure, are hallmark traits of ASPD. It's not just occasional dishonesty, but a consistent and persuasive behavior. Impulsivity. People with ASPD often act without thinking about the consequences. This can lead to risky behavior such as driving under the influence, engaging in unsafe sexual practices, or making snap decisions without considering the impact on others. Irritable and a tendency to become irritating and wealthy. An inability to see things from others' perspectives. Lack of remorse. Perhaps the most striking feature of ASPD is the absence of guilt or remorse for harming others, whether they've spoken wrong, manipulated someone, or caused emotional damage. Individuals would rarely express regret for their actions. The failure to conform to social norms. People with ASPD often refuse to follow social norms or laws. This doesn't just mean engaging in illegal activities, but also behaving in ways that are considered socially unacceptable, manipulating in everyday life. People that are isolated from other people, who they would most likely think dark thoughts. Individuals with ASPD often struggle with maintaining meaningful relationships through lack of empathy, along with the tendency to manipulate others, and makes it difficult to form close, trusting bonds. They might feel disconnected from their own emotions or the emotions of those around them, and this emotional distance can make interactions with others feel cold and unfulfilling. So individuals with ASPD often struggle with maintaining meaningful relationships. They lack empathy, along with their tendency to manipulate others, makes it difficult to form close, trusting bonds. Yes, and when they're like disconnected from their emotions or other people's emotions, it makes the other people feel cold. What causes ASPD? Now we for causes ASPD, um, causes of ASPD, those things cause explanation for developers to look at environmental and neurological genetic factors. Research indicates that ASPD may have a genetic component. Studies have shown that someone in your family has ASPD or another person may be at higher risk of developing the condition. However, not everyone with the family history of ASPD will develop it. And conversely, not everyone with ASPD has a family history of the disorder. Environmental influences, early childhood experiences, particularly abuse, neglect, or trauma, are strongly linked to the development of ASPD. Growing up in an environment where emotional support is lacking or where violence is common can increase the likelihood of developing this disorder. Additionally, children who grow up in a chaotic, dysfunctional household struggle to develop the healthy emotional regulation skills necessary for later in life. Neurological factors, brain functioning of their brains. Brain research has shown that individuals with ASPD may have differences in structure and functioning of the brains, particularly in areas that regulate emotions, impulse control, and decision making. This may help explain why they engage in impulsive, reckless behaviors that we reference. Diagnosis of ASPD. Diagnosing ASPD can be challenging, particularly because its symptoms may overlap with other mental health conditions. Professionals usually diagnose ASPD after conducting thorough evaluation, which includes a detailed listing of an individual's history and behaviors according to the diagnostic and statistical manual of mental disorders (DSM-5). There are specific criteria for diagnosing ASPD, which include consistent pattern described for the rest of others, a history of chronic before the age of 15. Symptoms must persist into adulthood, with the person being at least 18 years old. The diagnosis often requires careful observation of behaviors, and the individual may not be aware of their actions or many deny them. It's common for individuals with ASPD to be unaware of the extent of their manipulative or harmful behaviors, especially since they don't feel remorse for their actions. Treatment options. Treating ASPD can be complex and requires a multi-phase approach. Since individuals with ASPD are often resistant to seeking help, treatment is most effective when the person is motivated to change. While there's no cure for ASPD, there are ways to manage symptoms and improve quality of life. Psychotherapy is one. The primary treatment of ASPD is psychotherapy, particularly cognitive behavioral therapy, CBT. CBT helps individuals with ASPD examine the way they think, behave, and relate to others. It encourages them to recognize harmful patterns and develop healthier coping mechanisms. Medications, while there are no medications specifically designed for to treat ASPD, certain medications can manage symptoms such as irritable aggression or anxiety. These may include mood stabilizers, antidepressants, or antipsychotic medications. Useful when symptoms are severe or lead to other mental conditions like depression or anxiety. Inpatient treatment in severe cases when an individual's behavior is too dangerous to themselves or others. Inpatient treatment may be might include hospital stays or structured residential programs where the person can receive intensive care. Impact on society. ASPD doesn't only affect individuals who have it, it can also have a profound impact on society. People with ASPD are relying on criminal activities, behavior, involves theft, assault, and severe acts of violence, sexual acts. It is one of the common personality disorders among criminals. However, not everyone engages in criminal activity. Many individuals may navigate through society without breaking laws, but still experience difficulty in personnel, and professional relations. Their tendency may unbelieve, deceive, and cause significant harm to friends and family and coworkers. Lack of emotion and connection concern for others often feel that they should be towards. So Despite its challenges, there is hope. Treatment, especially therapy, can help individuals with ASPD improve their behavior and start to form more positive relationships. People with ASPD are who will change, but they must be willing to confront their behavior and work towards growth. While the road to recovery can be long, through support, many people with ASPD lead productive lives and manage their symptoms. Okay, thank you for today's deep dive into antisocial personality disorder. If you or someone you know struggles with ASPD, remember that support is available. Don't hesitate to reach out to a mental health professional or put them into a mental hospital to spend the rest of their lives there. And make sure to take the right medication. Mental health is also important, and just as physical health, and take the first step toward treatment can make it all the difference. Thank you, and have a nice day. And if you know someone with ASD in a mental hospital, they are not safe.